This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses or simply click on the link in our show notes and create an account.
We're going to talk about an unusual, not unusual, but not the most common cause of abdominal pain that we see. We see a lot of small bowel obstructions in the ED, and we admit a lot of those patients. We don't always put NG tubes in, but there's one type of small bowel obstruction that I want to specifically talk about today, which is an internal hernia. So that's when the bowel herniates through either a congenital or an iatrogenic defect in the mesentery. And it represents about 1 to 6% of all small bowel obstructions, but the mortality of internal hernias when they strangulate is very high. It's over 50%. So if we see this, we need to really recognize it and say this needs an immediate surgical consultation, and it's not the average small bowel obstruction. The reason it has such high mortality is because it leads to bowel necrosis quickly and ultimately sepsis. And so those patients die quickly from that. The presentation is pretty typical of small bowel obstruction. So it's abdominal pain, abdominal distension, nausea, vomiting, sometimes constipation. But because these hernias can sometimes be intermittent, sometimes people have pain, goes away, they look better, and then it comes back. So you need to have a high index of suspicion. The history is very important in these patients if you're thinking about an internal hernia, because the patients often have a history of laparascopic surgery, specifically if they've had a liver transplant, or more commonly what we'll see is bariatric surgeries, specifically the gastric bypass or a Roux-en-Y procedure. That puts people at significant risk. The evaluation is typical of what we do for most patients with abdominal pain. We get a CAT scan. The CT is over 90% specific and sensitive for detecting these type of internal hernias. CT findings are important. So if you're reading the CT report and you see a few of these things, you need to really be thinking about whether this could be an internal hernia. So number one, you can see a closed loop obstruction on CT. So if you see that, basically that puts the patient at high risk for significant mortality and morbidity. You can see dilated loops of bowels with a sac-like appearance. And then the most specific and sensitive finding is something called mesenteric swirl, which is where the blood vessels swirl. And you see that very clearly on a CT with IV contrast, and the radiologist will call that out on their report. The key is, versus some more standard small bowel obstructions where we may or may not put an NG tube in and admit them for bowel rest, these require an immediate surgical evaluation, and these patients often go to the OR straight from the emergency department because of the high risk for bad things happening and bowel necrosis. Because the internal hernias are sometimes intermittent, the CT may not be entirely diagnostic. So if you have a high suspicion, they have the right history, you may still want to talk to the surgeons about whether you need to consider a laparoscopic exploration. And, as we talked about, the treatment for these is not just admitting them to the floor, putting an NG tube in and seeing how they do. The treatment is an immediate surgical consultation. Oftentimes these patients go to the OR to decompress the obstruction in the hernia and fix that mesenteric defect. And if there's any signs of strangulation, because they're at such high risk for sepsis, we need to immediately start them on broad spectrum antibiotics that we typically do for sepsis. So again, not the most common small bowel obstruction, but important to know about, especially if you see those CT findings, especially if you see that mesenteric swirl on a CT report. You need to be thinking internal hernia first and foremost, and in the history of a patient who's had bariatric surgery.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.